Hi, welcome to week 2 of Healthcare Delivery Systems. This week we're going to look at regulating healthcare. And as part of our course, we're starting with the regulation of healthcare at the federal, state, and local level. And the reason why we started with this is because if you're enrolled in health records management or if you've had health records management, right away you start learning about the health record and what impacts it. So it's important for you to learn some of the key terms right away and some of the background on this to correlate with your other classes. So this component, we're going to talk about regulations, and the course objective is to describe the organization of healthcare at the federal, state, and local levels. So this is going to be the organization of regulations that influence healthcare. So this organization, what we're going to look at is what is the Department of Health and Human Services, what is the role of your state government in healthcare, and what is the role of the local healthcare organization. So the HHS is a federal level of government, and basically it provides the essential healthcare for all Americans. That's what it is regulated to do. It focuses on the needy and the underserved populations in the United States, and it also serves at the state level, local, and tribal levels. Its structure is the Office of the Secretary of the HHS, and it has 11 different divisions. Now, some of those divisions are more important to healthcare than others. This slide represents the organization of the HHS, and what I want you to note on this slide, and I'll use the pointer, here is the Secretary, the Deputy Secretary of the HHS. Below that, everything you see in this blue box, these are the 11 organizations that they impact. You have the Administration for Children and Families, or ACS, the AOA, the Administration of Agency. The ones that are really important to healthcare is the AHRQ, which is the Agency for Healthcare Research and Quality, the CDC, the Centers for Disease Control and Prevention, the Agency for Toxic Substances and Disease Registry, the Food and Drug Administration, and the most important to you is the Centers for Medicare and Medicaid Services, or CMS. Now, over here in the side box, you'll see what is called the Office of the Inspector General, and one of your assignments is going to focus on the Office of the Inspector General and what they do. And another important one up here that's not in blue was the Office for Civil Rights. In the Office for Civil Rights, they process complaints. But this is where we get a lot of the rules and the regulations that we live within healthcare. So when we talk about the ACF, they address the economic and social well-being of children and vulnerable populations. Well-known program for that is Head Start. You might think Head Start is not a health program, but Head Start is a part of HHS because it focuses on the health and well-being of children. We have the Administration of Aging, and under the Administration of Aging, that's adults 65 years of age and older. By 2030, almost 20% of our population is going to be age 65. And guess who's going to be taking care of them? Your generation. AOA, they fund non-medical programs to help promote independence and promote health. The longer a person can stay at home, the less health care cost. The Agency for Healthcare Research and Quality, AHRQ, you're going to see it several times in this course, but its mission is to provide data on healthcare in the United States. It is a great resource if you ever have to do any kind of project on health data. They've got quality outcomes, safety outcomes, effectiveness. They'll show you studies that they've done. They'll show you outcomes of studies like the effect of death rates on illness rates, how much people spend. So it's a great research. It's used in healthcare. It's used by the general population. And you will have an assignment on this a little later. Agency for Toxic Substances and Disease. Their mission is to prevent illness from toxic, hazardous, and substances. This has gotten bigger in the last 50 years. So their examples, arsenic, asbestos, lead, and mercury. Lots of government funding has going into abatement of asbestos and treatment for lead poisoning. So it's a very important organization. The CDC, they're responsible for health promotion, disease prevention, reduction of injury and illness, and prepares for emerging health threats. So for example, a few years ago was swine flu, but recently one of the big prevention efforts that they did was the outbreak of measles that occurred within the last year. So when that happens, the CDC is heavily involved in trying to isolate and find out where the outbreak started. Then you have the CMS, and as I told you earlier, the CMS is the most important one that you need to know. The CMS is the Centers for Medicare and Medicaid Services. Medicare and Medicaid right now, health-wise, insurance provision covers 25%. So 1 in 4 people are either on Medicare or Medicaid. Medicare is the largest health insurance in the United States, and it is funded by the federal government. It is for the elderly or disabled, and the insured person pays premiums. Medicaid is for low-income patients and families. Guidelines for Medicaid will vary by state to state, but generally the insured does not pay, or if they do pay, they pay a very small copay. And then we have the Children's Health Insurance Program, also known as CHIP. CHIP is to provide health care for children under a certain income limit, and it is a very beneficial service. Several years ago, for example, when my children were very young, CHIP did not exist, so there was very little help. The Food and Drug Administration, or the FDA, they're responsible for the safety and effectiveness of drugs. Also, drugs used in veterinary practices, what's put in cosmetics, what kind of radiology service we have, poisoning, they study all of that. Their job is to evaluate and approve new drugs. It's not their job to prove a drug is safe. It is the manufacturer's job to prove the drug is safe. Then the FDA evaluates it and may or may not approve it. Then you have the Health Resources and Services Administration. This also has gotten bigger. This is to improve access to health care for people with low income, no insurance, or some medical issues. So perhaps you've heard on the radio, for example, ads for HIV, assistance for people with HIV, support groups, access to medicines, privacy. All of this falls under the HRSA. The Indian Health Service, their mission is to improve physical and psychological and spiritual needs of the American Indians and Alaska Natives. It's accessible public health services. It's very culturally sensitive and recognizes the rights of all the different tribes in the American Indians and Alaska Natives. And there's a lot of them to take care of, but it is a service for them. The National Institutes of Health is the world's largest funding source. What they do is medical research. Like the AHRQ studies outcomes, patient safety, and quality. NIH, the difference is they fund research on diseases, specific groups, and research issues. So if you want to find out, say, about a specific kind of cancer, the NIH is a good site. If you want to learn about the effects of heart disease on an individual or how to spot a stroke, the NIH gives you the best information for that. It's also a very valuable source of information if you need information in a future class. The OIG, this is the Office of the Inspector General, also called Somebody's Watching You. But what their job is, they have to protect the integrity of the health and HHS programs. So what they're looking for instances of fraud and abuse, or in other words, people who are trying to cheat the system. They perform nationwide audits. They will do investigations. If they find abuses, they will report them to the Secretary and Congress. They will recommend correction, and they have a lot of power. So initiatives they've had are Stop Medicare Fraud Program, and they have a healthcare fugitives list. So one of your assignments this week is actually to look at a healthcare fugitives list and see who's out there. So I'll give an example of Medicare fraud. Medicare fraud occurs when somebody bills Medicare for a service that wasn't provided. So the most common kind of frauds is billing Medicare, say, for medical devices that were provided to Medicare recipients. But instead, they've stole Medicare numbers for many different people, and they billed people who never got it, and they get paid. Well, eventually they get caught. So fraud is very important. They also have programs to detect fraud, so they will do random audits of healthcare facilities. So you might see in the paper a healthcare facility was fined $1 million by Medicare or the Office of the Inspector General for overbilling services. That doesn't mean that they defrauded, but they take the number of incidences that they found, and they kind of look at that, the number of services they perform, and they estimated the incidence of fraud. Then you have substance abuse and mental health services, and that one you can look over. So let's go to the state level. At the state level, all states have a Department of Health, just like the government. The organizational structures may vary from state to state, but they're responsible for disease treatment, care of populations, health promotion. So usually the state governments will partner with the HHS and how they function. There is a National Academy for State Health Policy, and their mission is also to improve healthcare access and quality. Then you have your local healthcare or private healthcare agencies. These can be independent providers, group practices, single provider practices, corporate health care that provides care for employees, families, and retirees, community health centers, lots of different local agencies. You also have hospitals, profit or nonprofit, government supported or not. You can have a general hospital or a specialty hospital like a burn hospital. It can be affiliated with a university, or it can be based in a community like a local hospital. They can be a single or in a chain. And you can get critical access, and critical access hospitals get different reimbursement from Medicare. So how do regulatory bodies function? Back to slide 5. The CMS, the Centers for Medicare and Medicaid Services, they provide oversight for how healthcare services are provided, and they set the rules. And if a provider wants to receive compensation for their services, they have to follow the rules from the CMS. This is what you need to know. The rules from the CMS are published in a book called the Code of Federal Register. In the Code of Federal Register, all the regulations for a hospital, long-term care, you name it, are listed there. These are reviewed and updated annually. And as an HIM professional, you're expected to be able to locate and apply the regulations as they pertain to HIM functions in your organization. So as you go through the program, when it says, the Code of Federal Register says, this has to be done in 24 hours, or this has to be done in 30 days, this is where it comes from. It's a federal rule from the CMS that is published in the Code of Federal Register. So to summarize, the most important thing is what I just said. CMS sets the rules. So when you're in health records management, all the things that you learn for documentation in the health record, and when it has to be completed, and how it has to be completed, and where it is stored, and how it is stored, that comes from CMS. And the CMS is a component of the HHS, and the CMS publishes their rules in the Code of Federal Register. It's important for you to know where these come from. So to summarize, we have multiple agencies. These agencies of the HHS provide oversight of many different functions in disease prevention. They have the State Department of Health and so forth. So at the end of this, what you need to do, this is just a little nutshell version of this week, but review your PowerPoint slides for this week. The transcript provided in your course room in Brightspace gives you more information about each of these organizations that you can use for your discussion questions. But make sure you read it and you understand that these federal levels of services set the rules that all healthcare delivery systems have to live by. So that's week 2. Thank you. Enjoy your assignments and discussions. Thanks.